On today's Two on Your Side Town Hall, will you take the vaccine? A lot of people say no, even though scientists stress that you should. So we're going to talk about some of the concerns with an expert.
Plus, Facebook one-on-one. The social media giant answers our questions about the role misinformation is playing in people not wanting to get the shots.
And later, Erie County's clerk will join the show live to talk about why he has joined the effort against school zone cameras in the city of Buffalo.
A lot to get to tonight. Thanks for being here on the Town Hall. I'm Kate Welsh-Schofer.
Hi, everyone. I'm Michael Wooten. We do want to start tonight with something that really could threaten a lot of the progress that we've made over the last few months in getting people immune to the coronavirus, and that is vaccine skepticism.
A new scientific poll from the Associated Press shows almost a third of Americans say they are either certain they won't get vaccinated or they probably won't. The numbers show skepticism is greatest among younger people, people without college degrees, Black Americans, and Republicans.
Among those who say they definitely won't get the vaccine, most say they're worried about side effects. Other concerns, though, are that they don't think they'll need it, they think it won't work, or they just don't trust the government. Meanwhile, Facebook is out with some news specifically about Western New Yorkers and asking about the vaccine, and we'll get to that in just a few minutes.
Right now, we welcome to the show Dr. John Sellick, an epidemiologist at Kaleida Health, a friend of the show. Thanks for coming back. We appreciate it.
So, Doctor, this obviously
Thanks for having me. I always enjoy being here with you.
Yeah, this is such an important topic. So we want to start with, the biggest question that arises from this skepticism that we're seeing out there. And it is, of course, if, 2/3 of the population are willing to get the shot, that means maybe a third isn't. Are we going to have enough people vaccinated to reach herd immunity and essentially end this pandemic?
Yeah, I think it's a very complex question. You led into it very well. Because this is not a uniform process or problem. There are a number of different reasons that people are not getting the vaccine. We talk about the people who are absolutely vaccine resistant and the others who are vaccine hesitant. So then you look within those groups, and again, the fear of side effects, the fear of not knowing if it's safe. Unfortunately, our government had called this Operation Warp Speed, which gave the idea that this is just being rushed through. Nothing could be further from the truth. These vaccines have been extraordinarily well vetted. The CDC's Advisory Committee on Immunization Practices, the FDA, Vaccine Advisory Group, the information that those people have is available to all of us to look at. And I think that there's clearly safety. Everything has a little bit in the way of side effects. There have been very few real showstoppers. So I think that what those of us who are very passionate about getting people immunized, especially for me as an intern, is getting adults immunized, is again going after that group that is hesitant and educating them. That it's safe, that the side effects are minimal, that all the foolishness that's been, propagated about, I don't even want to, repeat them, but the silly things that have been said about this, that all of that stuff is untrue. So hopefully we'll be able to get a good chunk of those vaccine hesitant people. With time, we'll be able to move them along and get them immunized.
We talk about people being concerned about safety and side effects, and saying that that's not necessarily something that they should be concerned about. Understandably, if they are, what should they be concerned about if they decide not to get the vaccine?
Well, the big concern if they don't get it, falls into two categories. Is number one, personally, what happens to them? Because if they're otherwise in a group that is high risk of having a bad outcome with this infection, or if they transmit it to other people in their family, say parents or grandparents or other people who are at high risk. So there's that, that very down home point that this will affect someone individually or their family. And then there's that bigger societal effect that you talk about, our need to get to population immunity. We have to get to a certain number, and we don't know exactly what that number is. But it's going to be somewhere probably in that 70 or 80% range. So it's going to be, very important. There was a recent Kaiser Family Foundation. They have an ongoing similar kind of survey to this National Opinion Research Center one, showing that we're up to about 71 or 72% of people nationwide who say they will get vaccinated. We need to keep pushing that. We want to get as high a percentage as we can, and that's going to give us our best chance of breaking this cycle and bringing this pandemic to an end, which we all desperately want.
Yeah, and of course that's half the battle. The other half is producing enough vaccine and getting it into people's arms. But you mentioned the misinformation, and I think this is so important. It's fueling so much of the skepticism. We're going to talk in a moment with someone actually from Facebook to see what Facebook is doing. But from your perspective, I wonder if you can address some of the misinformation that's out there. And I know it's not good to repeat it, but one thing that I've been asked about so much and that I've seen spread so much is people saying, there are X number of deaths already attributed to the vaccine. Someone emailed me today and said the number's now up to 550. It's just not true. The CDC has connected 0 of those to the vaccine. Can you just address that?
Sure. The problem that we have is we always tend to temporally associate things. So if you're giving vaccine to people who are older, there are going to be a certain number of them who die on a regular basis anyway, of heart disease, of strokes, of cancer, whatever it is. So if they happen to get the vaccine and then a month later they have a heart attack and die, that doesn't mean that they died from the vaccine. So you're always compare within the groups of people who got the vaccine with people who didn't get the vaccine. And what we find is that there is really no excess of deaths. The other stuff that, like I say, we don't like to repeat, injecting microchips and it's going to make you sterile and all these kinds of things. This is just absolute, nonsensical conspiracy theory, type of stuff. Absolutely no basis in fact, any of that. The 2 vaccines that we have, the 2 mRNA vaccines, the BioNTech, Pfizer, and the Moderna, and now hopefully we'll have the J&J, the Johnson & Johnson Janssen vaccine, which is an adenovirus vector vaccine. Hopefully that will get approved sometime over the course of the next few weeks. We're really hopeful that by the spring, we're going to have a lot of vaccine available. And then the problem is, as you say, getting it administered to people. But once we get that stock, then it makes it easier to move us forward.
We so appreciate the information. Dr. John Sellick, epidemiologist at Kaleida Health. Thanks again for being here.
Thanks as always, Doctor. We really appreciate it. Vaccine skepticism seems to be quite a bit lower in our region, at least according to some data collected by Facebook.
The social media giant is surveying about 50,000 people a day nationwide. Here's a map of all the metro areas, and generally the lighter the color, the more vaccine hesitancy.
Yeah, and look specifically at the Buffalo metro area, and when people were asked if the vaccine were offered to you today, would you take it? 76% said definitely yes or probably yes. That is better than the state and national averages.
So this is part of Facebook's efforts to combat vaccine misinformation on the platform, taking down posts that are provably false or conspiracy theories.
Earlier today, I talked about that with Laura McGorman. She is a public policy manager with Facebook's Data for Good team. Obviously, Facebook is used by some people to spread misinformation. How then do you balance that desire to crack down on misinformation, especially something as serious as vaccine acceptance, while at the same time not clamping down on free speech rights?
Sure. So we draw a pretty clear line based on the guidance of public health experts, and we only take down hoaxes that have been widely debunked by the science. So obviously this is a new vaccine, and legitimately so, people will have questions. Is the vaccine safe for pregnant women? Is the vaccine safe for children? These are things that scientists have yet to confirm, and so we're going, of course, to allow people to ask those questions online and exercise in a debate around things that have not yet been disproven by science. But when we have a fact that's been wildly disproven by scientists and leading experts, that's when we have to exercise a policy to take that down, because we really want credible information rising to the top and misinformation really not as easily able to be found, because we know that misinformation thrives in the absence of the truth. And we want to make sure that credible information is indeed rising to the top.
And recognizing that that can be sort of a difficult balance, right?
You know, and it's something that we have to put public health experts in the driver's seat on. And that's why we rely on groups like the World Health Organization to tell us what are these hoaxes that have been widely debunked, and how do we put scientists and the experts in the driver's seat in terms of determining where that line is.
And Facebook is also giving health organizations about $120 million in free advertising so they can amplify proven information about vaccines. Plus, Facebook created a vaccine information center to help people find out things like where to get vaccinated. And we know, Michael, that some of these posts can just spread like wildfire. So it's a tough battle.
Yeah, and you know, I asked flat out, you know, some people who are critical of Facebook for doing any quote unquote censoring of this. I was like, so what would you say to people who say, I don't want Mark Zuckerberg sitting in his big office deciding what's true and what's false? And they were saying, yeah, that's not what happens, that it's the independent kind of organizations that are flagging the things that are especially dangerous.
Yeah, and they've certainly taken heat for not doing enough over the last several years, so they're trying something.